Hi, everyone, and thank you, Daniel. It's great to be back amongst NextMed friends. I love coming back to the NextMed community. This is a special place for me. Since my first talk here about 5 years ago, when I came into this community with an immense sense of appreciation and gratitude. I had just gone through my own personal patient experience where I was dealing with a 6-pound kidney tumor, which I fondly named Bertha. I look around the room and I see a lot of familiar, friendly faces who were with me in that part of my life, who helped me stay positive and stay curious and find solutions where others were seeing obstacles. And here I am today, still connecting dots and looking for solutions across silos and across disciplines, with the same appreciation and fueled by the same patient experience to bring your attention to another silo, often overlooked yet so critically important for both patient outcomes, healthy communities, and the bottom line. Show of hands, how many of you think about their dentist when I ask you to think about your healthcare team? The dentists in the audience should not raise their hand right now. But not many, and neither did I up until a year ago. And that's where I really realized that oral health is in fact overall health. That's right, the oral health is not contained to that one visit in the dentist office. It permeates every aspect of our overall health in our lives. Literature shows, and the data shows, that oral health is connected to our brain health, to our bone health, lung health, heart health. The data is clear. 1 in 4 Americans die every year from cardiovascular disease like hypertension, stroke. We also know that periodontal disease or gum disease is the 6th most prevalent non-communicable disease in the world. Severe periodontal disease is connected to higher risk of cardiovascular disease, developing high blood pressure, and making your arteries thicker and narrower, which leads to all kinds of cardiovascular complications. Untreated oral health issues or poor oral hygiene coupled with severe periodontal disease are leading to higher risk of developing dementia and cognitive decline. We see also in literature that 30% of adults in the US over the age of 65 have lost all of their teeth due to various healthcare issues. You can only imagine what that does for that patient's ability to communicate, ability to get the right nutrients they need, ability to be a productive and meaningful member in their community. We know that a higher prevalence of tooth decay and periodontal disease could lead to higher risk of developing chronic obstructive pulmonary disease. And a recent study in Israel saw that with over 500 patients who were positive for COVID, those who also had untreated periodontal disease were 3.5 times more likely to need intensive care units and 4.5 times more likely to need a ventilator. The data goes on and on. We know preterm labor increases with untreated cavities and periodontal disease. We also know that oral health is connected to patients' likelihood to develop diabetes. Oral health is overall health. Treating oral health issues, however, is not only the right thing to do clinically, but it makes sense economically as well. Untreated oral health issues have been connected to loss of millions of dollars in productivity, lost hours in the school. 1/3 of every child loses a day in school due to oral pain. And more importantly, what we see here is that over $500 million in Medicare spending is connected to visits to the emergency room that are connected to dental health issues. And for the clinicians in the audience, you know that when you have a patient that presents to the ED with a dental pain or dental issue, there are two things you could likely do for them. Give them painkillers or antibiotics. Neither of those two treats the underlying issue. Oral health is also a health equity issue. We know that Black adults are more likely to have an unmet dental need, yet they're less likely to have a routine dental visit in the last year. We know that patients from the Latino community are more likely to report having difficulty doing their job because of poor oral health. That number skyrockets when we talk about people living in poverty. Untreating oral health or delivering oral health care, like most of the other parts of our healthcare system, is expensive. The cost of dental care outpaces the growth in medical care costs, and by 2025, it's projected to reach $185 billion. Let that sink in for a moment. 4% of total medical spending. And yet, when we think about investment in innovation, measured by venture capital spending or venture capital investment in oral health companies, that is merely 1 to 1.5%. We did the math. In 2020, less than $1 billion of VC funding went into oral health companies. To 2021, it was a bit over $1 billion. Again, what we're seeing is that dramatic need for innovation, creativity, and problem solving, yet we're really falling short in, at least by this parameter, to encourage that. So with that level of funding or underfunding of innovation, there's no surprise that the last large-scale innovation that had a truly transformative impact on patients and communities was 77 years ago. In 1945, when fluoride was invented and added to the drinking water in Michigan. Did not require AR, VR, AI, or quantum computing. It really required a lot of stakeholders to come together and make it possible to act on the clinical knowledge that for the states where there were higher prevalence of fluoride in the drinking water, there was lower prevalence in tooth decay. And what we have seen since then in the last couple of decades is that over 60% of American households have access to fluorinated water, and over 30 to 40% in Canada. Not much has changed since then. And I'll give you my favorite example on that. Toothbrushes. The first toothbrush came up in the 1400s in China when they took boar hairs and slapped them on a handle. In the 1800s in the UK, an entrepreneur, William Edis, came up with a commercial toothbrush. We improved on it in the US in a couple of years after to get us to this prototype of an electric toothbrush. No toothbrush that old should look as similar to what we're using today. And when you look at the patient experience, no patient experience decades old should still inflict anxiety and pain and confusion as it did back then. Not only has our patient experience not changed dramatically, but the overall outcomes have not changed that much either. The total prevalence of tooth decay, severe periodontal disease, or loss of natural teeth globally has not changed since the 90s, hovering around 40%. So something needs to change. And we all need to be part of it. privileged to lead a team of change agents and inspired dot connectors as part of my role at CareQuest Innovation Partners, where we have curated a set of capabilities that allow us to think about the barriers to adoption of innovation, investment, and outcomes, and put together those resources and make them available to the innovators and solutions out there. Some of those capabilities include things like providing capital for early stage companies who are looking to connect medical to dental care. Companies like Mouthwatch, the first virtual oral healthcare network that provides access to dentists across all 50 states. So that mother of two who lives in a dental desert and can't get to the dental office still has access to a virtual consult. Companies like Enable Dental, who provide portable at-home dental care for patients who are homebound. Companies like Incisive Technologies, who actually, if you go back, you'll see the Incisive Technologies company and what they do, because it's really disruptive. They have figured out a way to take diagnosing tooth decay outside of the dental office and put the equivalent of a blue rinse in your mouth. And when the blue rinse changes color, that is able to diagnose caries. For those companies who are a little bit more grown up and have a solution that is ready to go to market, like this company here, Vivardis, who have created a novel peptide that when it's applied to the tooth, it rebuilds, regenerates enamel. The talk about tissue regeneration is not a thing of the future when we look at oral health. Companies like Vivardis have been able to accomplish this. And what we've been able to do for them is create clinical proof points and business proof points by connecting them to health plans and dental plans and running longitudinal studies that observe the outcomes on the clinical side, but also the business side from applying those types of minimally invasive procedures. So next time you're at your dentist and your dentist observes a small black dot on your tooth, that first and second surface lesion, instead of them filling it and drilling it and giving you a filling, they might give you that Curodont paste that allows your tooth to rebuild and minimizes the need for fillings. We also do accelerator programs that allows companies that are not in oral health to come into the oral health space and innovate. There is no lack of shortage of ideas, and the problems that we see in the oral health are very similar to problems the best and brightest minds are solving in other industries. Last year, we ran the first of its kind integrated care accelerator program, founder-friendly, where no startup had to give up equity to be part of the program. SMILE is an abbreviation and an acronym for simple, minimally invasive, integrated, low barrier to access, and equitable solutions. SMILE solutions exist across multiple disciplines and fields. It's our role to put them in front of the clinicians and the patients and validate them so they can scale. I want to bring your attention to 3 of them who you could actually meet here at the iLab. OrisDX takes saliva-based diagnostics and makes it reality today. With their saliva-based solution, they could take a saliva sample, your dentist could take a saliva sample and screen for oral cancers early. And we know that the odds of overcoming that cancer and having a higher quality of life are much higher when you diagnose early. Waiver is a technology and a platform company that completely reimagines your experience by going to the dentist. They put in high quality, custom and licensed content delivered through augmented reality. Some of those glasses that we saw cutting edge surgeons are using for surgeries and training, Waiver is putting in the dentist office so that patients with phobia and anxiety could make it to the dental office and participate participate. So next time, when you think about a dentist office, you start thinking about the new release of the video or the movie that you get to watch while you're in the dental chair. Sleep Architects is a platform that connects medical and dental teams so that the patient could get diagnosed and treated with the appropriate treatment plan in a coordinated and an integrated way. So I invite you to go in and say hi. I want to focus on a couple of things that we've seen in the last months, really, that show tremendous potential and acceleration of capital, interest, and innovation in the field. There are three trends that I want to bring your awareness to. Number one, medical dental integration is a reality, and it's urgently needed if we're going to combat the rising cost of care while still delivering quality of care to patients. What we're seeing is some of the largest companies, like in the dental space, like Pacific Dental, who are in over half the states in the US, are now adopting Epic as their EHR. We're seeing collaboration between NIH and different data exchange organizations to adopt similar standards so that data interoperability becomes a fact. Second trend that we're seeing is higher valuations and more activity in the startup ecosystem. Quip was the first company that recently raised funding with a $1 billion valuation, and they, again, are positioning themselves as a platform for wellness and integrated care. There's so much innovation in that space. And finally, I want to make sure that we are looking out for the opportunities to find the next level of breakthroughs that would connect care, the dentist, to your overall care team. And it doesn't have to be in the dental chair. It could be in a community clinic. It could be at your home or virtually. Regulators are at the table and paying attention to those trends. The company that I mentioned, Vivardis, with the enamel regenerating product, they weren't able to get reimbursement or to get in front of the dentist because there was no code that would reflect what the technology in this product could do. As of this past Thursday, we were able to work with the American Dental Association and a multitude of other organizations to pass a new CDT code that allows clinicians, dentists, to bill when applying that product, and insurance companies to decide whether or not they want to reimburse it. Last month, we worked with the American Medical Association to make it possible for primary care physicians to apply a silver diamond fluoride, which is a treatment especially used in kids to prevent cavities or arrest the development of tooth decay. Regulators are paying attention, and what we need is more of that collaboration across industry, regulators, investors. So I'm very happy to announce that our cohort of the second year cohort of 2023 Smile Health Accelerator actually is accepting applications starting today. I'm very excited to see the solutions and the innovations in this room, and I invite you to, if you're working on a startup or a solution that makes care more integrated, equitable, and accessible, I invite you to apply. And if you have heard this talk and you have questions and you can't wait to get in there, I really invite you to our systemic health breakout tomorrow afternoon. With that, thank you.
Thanks. Amazing work. I'm going to turn on the app with my toothbrush now and actually use the quantified brushing. Now that we can now connect some of the dots, what can start to happen in the dental office where people visit more often than their primary care office, not just checking blood pressure, but maybe other convergences? What might you see for that future?
I'm very excited about the potential of what the dental team could do for our overall health. If you think about it, on average, a visit with a primary care physician lasts about 15 minutes. a hygienist has on average half an hour to 45 minutes with that patient. What we want to do is the dentist to start engaging you in a conversation about your diabetes, about your sleep health, about your risks of overall health, and you want your primary care physician to be talking to you about your oral health. So that's the integrated view, and I believe we have all the resources to make it happen.
I had my oral microbiome tested, and it inspired me to go get a tooth cleaning. So
that's right.
Awesome.
There you go.
All right, thanks, Mariya.
Thank you.
Shakes. All right.